For those of you just joining us, we are now at the top of the hour, and thanks so much for coming to the webinar today, which is ADA Coordinator Lessons Learned During COVID-19. And I'm going to go ahead and introduce our panelists today. Put on your cameras so I can see everyone. Hi, everybody. Thanks so much for joining us. So today we have with us some of those brave ADA coordinators. We've got Christina Mitchell from the District of Columbia government. We've got Matt McCullough, who works with Christina in DC. We've got Hillary Ramon, excuse me, who's the ADA coordinator for the city of Pittsburgh. We have Sharonda Huffman representing the city of Baltimore. And Kim Knuckles was not able to be with us today. So we will work with our panelists that are present. I did want to just review with anybody who is new to the idea of an ADA coordinator. ADA coordinators are also called Title II coordinators. It is a requirement in the law itself as part of Title II that for state and local government entities, and again, this only applies to state and local government, any that have 50 or more need to assign somebody to act as a representative who can handle grievances or complaints with regard to, say, accessibility or other disability access related issues. And they also handle the self-evaluation and transition plan for their entity. So pretty important responsibilities that they handle. So we're going to go ahead and after we can go ahead and get started with questions. So I do want to know, as ADA coordinators, what have you found to be your most important functions overall? And I'm going to go ahead and start with Sharonda.
Thank you so much. That was a great question. Well, one of the main things that I think my important function is a lot of people in my city don't know what an ADA coordinator is. So I've really had to educate our city agencies on what my role is. I have been in the role for 2 years, but prior to me, there was a gap. My predecessor passed away. There was a long-term person around. He's like famous. And so I just feel like the ADA coordination, we basically had to do a rebuilding. So just educating people on what my role is. I feel like I'm more of an ombudsman for many constituents, educating them about disabilities and their rights, and directing the other agencies on how to be compliant when I get a grievance. So, but the most fun thing for me is outreach and educating people regarding some of their rights with disabilities. Thanks for that question.
That's great. Thank you so much. Anybody else want to jump in?
So this is Matt McCullough. So Christine and I have been with the same agency for 13 years. We were created essentially by the deaf community. Back in 2007, prior to 2007, the deaf community in DC were having trouble trying to access the government services. So one of the greatest things that we learned about serving as the ADA coordinator, it comes down to offering effective communication. Christine, so do you want to offer anything more?
Yes, definitely. One of the things that I think has been most important for us was offering accessibility. And that was accessibility across the board. We don't only talk about like the effective communication that Director McCullough spoke of, but also about physical accessibility. We work a lot within our district-owned buildings to make sure that accessibility is possible for all meetings, services, and programs. And I think that's one of our largest piece of the job that we're doing right now.
Thank you.
Great. Yeah, I just wanted to say that we actually, the ADA Center, completed some research recently, and the top thing that ADA coordinators asked about, one of their biggest issues was exactly what you're saying, Christina, which is facility access. So you've definitely confirmed that the research is right. So, Hillary, did you have any thoughts on that?
Yeah, absolutely. It's so funny because I had a really similar experience as Sharonda, where somebody had been in the role before me for a really, really long time and was a total rock star. But the ADA was, I think he'd been doing the job since it was like signed into law, and did a lot of great things in the city. But I was sort of tasked with kind of reformatting my role and figuring out how we could best serve accessibility needs in Pittsburgh right now. And so for me, that's kind of been centered around connecting my work to other departments, things that they're already doing so that I can help to amplify inclusion. So, if we're doing a language access plan for people who are, limited English proficiency, I make sure that we talk about, how can we be inclusive about, ASL and tactile interpretation and Braille, and making sure that, when we're doing one project, we're including disability access with our greater initiatives, and that goes along with parks and our right of way and all of that. So I've really found that one of my most important functions is like actively resisting government silos, which is sounds harder than it is. Just kind of making sure that I'm out there and I'm working with all of the different departments. I'm a funny ADA coordinator who's in city planning, which is sort of odd. I don't know that I've heard that anywhere else, but it's been great because I'm really able to kind of navigate the needs in other departments pretty freely, and so that's been a very important function of mine, and I found it to be very helpful.
Thank you so much. So my next question to everyone is, with regard to those functions, what has been your most important role with regard to COVID-19 in state and local government? I see Matt there. So Matt, you want to go ahead and start with that one?
Sure. So in terms of DC, our agency, we served in 4 different roles during the COVID-19. One has been training. The other aspect has been effective communication. Policy development has been a third, and simply outreach to the community. When things shut down, people didn't know what resources were available, and many of the agencies, their functions were being modified. So we did 4 different activities during that time that kept us super busy. It was 24/7 for the first 3 months, and so over time we started to ease into that role, and we're still doing it to this day.
Gotcha. Yeah, important stuff. Sharonda, did you want to go ahead and address that one?
I'll let Christine go because we're going to stick in DC. Go ahead.
Sorry, Christine.
Yeah, I was going to say one of the big things that we did, which was a first for us, was because we had to create our own stand-up hospitals in a new location, which was actually our convention center. Because we had to do that, it took us a new level of figuring out accessibility. And this was everything from understanding the level of Wi-Fi that we needed for the VRI systems to be there, including bed distancing and all of these new things that we wouldn't usually actually have to take care of. But because we did stand up a new location specifically for COVID, and also the testing locations, having to access those before we were able to open those up. Our daily was really making sure that all of our day and out press conferences were always accessible. There was a lot of information that was getting pushed out at one time. And because of that, we just wanted to make sure that it was always fully accessible, no matter where it was going to our constituent base. So I think that was definitely one of the things that really, like Matt said, kept us busy, because we were always figuring out if there was something new, something else, something we needed to add on. And because of that, just to make sure that everything was accessible on every level, that definitely was, it was a test. But as we kept going on, it became a lot easier because we already knew what to do.
Gotcha.
And we were also, well, the 40% of people, 40% of the employees still need to report physically in at the workplace. So luckily, Christine and I are able to work remotely, but we need to come up with policies that incorporate reasonable accommodations for folks working at the physical sites and also working at home. So how do we continue accommodating our employees with displays at home? And we need to go through some policy changes in terms of that. And also the fact that we have a huge drug population in DC, when it came to contact tracing, there were a lot of phone calls being made, but as you guys know, that helped with that person being contacted and told that they were possibly exposed to COVID-19. So we worked a lot with our Health and Human Services agencies, particularly the Health Department and State. We need to rely on DRI video remote interpretation processes, a lot more reach out to the deaf population and so forth. And we really emphasize that we need to make sure that when people need to file for unemployment, that now that people understand that they can do it online, or if they need to speak with a person, or that if they need a silent person, that we would all figure it out. So it took a lot of us to get to the point. For some, another point is that we were dealing with the DC public schools, and many of the schools were not necessarily prepared to do online learning. And so, which means that for students with IEPs or Section 404 ones, they still need to be accommodated, which meant that many of the online platforms that the schools were using were not necessarily Section 508 compliant. And so my employees and I were constantly trying to train folks on what to consider in terms of making online platforms fully accessible, and it's still a learning process for a lot of folks. Thank you.
Sure thing. Thank you.
I'll go next. I just want to say that we have had the opportunity. One of the most important roles I had was having the opportunity to say my worth, okay? Because I think that the COVID-19 has exposed a lot of inequities in the disability community that are in Baltimore City. For instance, specifically, Matt brought up a good question, press conferences. You can look at the federal government before, and there wasn't a sign language interpreter at the press conference when we looked at the president. And I just have to be honest. The COVID-19 and all the information coming out fast, and you don't have effective communication for the disability community, that's a big problem. I had a lot of complaints. So one of the things we implemented is we have a sign language interpreter at all the mayor's press conferences. And like I said, we are rebuilding. So a lot of the things that I've been asking for things to happen, they actually started to happen because it was necessary. So I also, at the same time, we had voting. I worked with some nonprofit agencies. I did inspections with, it was actually Common Cause Maryland. I did inspections of some of the voting facilities. The difference between DC and Baltimore City, they're like their own state city, where a lot of the like the voting is something that is done by on the state level. So I had to kind of be an advocate, saying they need this. When they were going through the process of how they're going to do it, you know, I had to like be on those phone calls and speak up for the disability community. So I have new roles now, but I think that was my most important roles in, you know, since the COVID-19 isn't going away anytime soon. So I have some new roles that I'm beginning, but it was really inserting myself into everybody's role. Say, are you looking at accessibility? When you're doing these online formats, do you have closed captioning? A lot of people don't even think about those things. So, but that was a good question. Thank you.
Yeah, I'll jump in here too. You know, just underscoring what my colleagues have already said. You know, the way that we did things changed so much during the pandemic and so quickly. And, you know, without, you know, having some leadership struggles nationally made it really hard to figure out, you know, how we were going to do all of this and prioritize it correctly, keep everybody safe and informed. And, you know, that all changed, but obviously our mandate as ADA coordinators didn't change. So, you know, things like emergency communications and moving operations online, you know, all of our board and commission meetings, all of these things are online. It changed the way we meet that mandate, the way we do effective communication, reasonable modification guidelines, all of these things are going to change, but, you know, shifts in operations don't really change our duties, and it shouldn't result in any kind of abdication of duty. And luckily, you know, people at the city were very, very responsive, but it's been hard. You know, it used to be we'd get a request for an ASL interpreter at a meeting and, you know, you're good. Now everything's online. And so things have to be accessible, not just to those attending at that time, but, you know, we put everything on YouTube. So it needs to be accessible in real time and for posterity if somebody's going to watch that meeting at a later time. And so it really has blown up and emphasized, you know, our needs, the needs of the disability community and kind of the importance of ADA coordinators. And so that's kind of been an unexpected benefit, but it certainly adds to the pressure of how are we going to get all of this done?
Great, thanks so much. So that kind of leads into my next question, which is what overall, I mean, I imagine the landscape changed for you definitely. What have been the most frequent questions or complaints that you've received over the last year? Hillary, you want to start since you finished the last round?
Sure, yeah. I have not noticed, you know, we get a lot of the same, funnily enough, maybe reassuringly enough, we get a lot of the same issues, but one thing that was certainly different was during the summer in particular, when we were doing, you know, changes around parking, changes around public right-of-way, because we were trying to allow for more outdoor dining, right? And so how do you manage that? You know, the sidewalk is a public good. We certainly don't want to infringe on people's rights. People with disabilities obviously need the right-of-way to be maintained. And so, you know, everyone does, but, you know, it just as Sharonda said, you know, kind of staying firm on, no, we're not going to do it this way. We have to make sure that we're going to keep our public right of way safe and accessible for everyone. You can kind of be the lone voice in a room sometimes, because obviously we want to support our you know, our local businesses and such. And so it gets to be a situation where you're weighing people who are struggling against people who are struggling. And so it's not a good situation for us to be in. But, you know, I've been really lucky in the sense that most of the people that I've worked with at the city have been very, very responsive. It's just one challenge is that a lot of times as an ADA coordinator, you know, you're not always in the room when those decisions are being made. And so we try to be proactive, but sometimes we end up having to be reactive and changing things that we tried to do. People get used to having their sidewalk dining, and then we have to take it away again. And so it's kind of reiterated the need to be more proactive and work with your ADA coordinator before you're going to take on some big shift in operations. Thanks.
So in terms of DC, the fact that everything needed to go online, that really places folks with displays a huge disadvantage to them because they may not have the internet, they may not have the assistive technology, and if you're able to get online like we are right now, we're using GoToMeetings, and so there are other online platforms that people with displays find more accessible, primarily Zoom, and if you work for the district government, we're all encouraged to use WebEx. And when you're using different online platforms, we definitely need to test the overall accessibility because one, I noticed for GoToMeeting, right now we're using captioning, but if you need to use sign language, are we able to pin the sign interpreter plus a foreign language interpreter? So these online platforms need to be fully accessible to all sorts of people with different abilities. And so it gets a little sticky when you're doing outreach events with different people. And right now, most of you would appreciate this, that my agency is currently developing a new homestead community integration plan for the district, which requires a lot of outreach, and which means that when we do the outreach, we need all these different systems to be working together cohesively, and it doesn't always work out because there may be human error going on. There may be the internet Wi-Fi not working. So a lot of factors need to be working in our favor in order to do these outreach events online. So it's a constant learning process for all of us in terms of understanding what do people with disabilities need in order to still access the same government services and programs through the virtual world as much as possible. Thank you.
Great. Thanks so much, Matt. Oh, Sharonda, did you have a thought on this as well?
Yeah, just real quick. I think I want to piggyback on what Matt said. I think the most frequent complaint I had was effective communication. There was so much stuff coming out that people just did not know what to know. Another thing is, as far as effective communication, not having the right sign language interpreter or the right platform so people can, for accessibility. Also, people just didn't know who to call because there's, you have a city and state partnership. So a lot of people had complaints to me. People who weren't getting their money, their checks. And, there was a big issue. So it's always good to have some kind of state partner or some other, have communication with other agencies so you can kind of like, hey, I have this problem, and ask someone's permission. Can I try to reach out for someone for you? Because some things I feel like I am just I know a lot and I know who to contact, but I just can't fix a lot. Sure,
right. That makes sense. You're kind of coordinating. That's part of the role. So, so to go into the next question then, and we did have a quick comment from somebody who said, they work for a Center for Independent Living, and they said the biggest change, the biggest thing for them has been moving so much of this online and having to use technology. Big learning curve, I think, for everybody. So what would you say the most challenging things have been for you over this past year?
So for DC, I think then this question would probably be in the same response across the board, that it takes a toll mentally and behavioral in terms of telling folks that they have to stay home, that they should be, that they can't be in large groups. For many of us, where we like that human contact, and when we're told that we can't be in public having dinner with our friends or family members because of this global pandemic, that really takes a toll on everybody. And so in terms of my employees, my agency is quite small. We have 12 employees, and I constantly try to gauge how well my employees are doing, and it's hard not to physically see them on a day in, day out aspect. And so and I can only do so much. And the DC government has done a very good job about offering different types of interactive trainings and stuff like that. But at the end of the day, it may not be enough for people to feel secured and safe and feel connected. I think that last piece, feeling connected with the rest of them, with the rest of the community, is definitely taking a toll on everybody. And so that's one of the greatest challenges that I think that we had to undergo over the past year. Thank you.
And we had somebody who just made a comment, Matt, that one of the issues that they're having is trying to reach those who have been displaced because of accessibility. So, you know, definitely an issue during COVID times. Sharonda, you want to go ahead?
Yeah, I think the most challenging thing throughout the last year is you can Google Baltimore, but since I have been the ADA coordinator over the last 2 years, we've had changes upon changes. So the first one is I've worked with three mayors in the last 2 years. So, you know, you have different political things on what's the priority. Disabilities hasn't been the priority for most of the time I've been working. Then we had a virus that took out our whole computer system. So it's like, okay, now we got to start from scratch because we have to deal with that. And now we have the pandemic. So we have a lot of exposure to not addressing disabilities, and now we have to address disabilities. So now I also work in an agency who's never had disabilities in its agencies. So you have competing priorities. So the biggest challenge for me is defining my role and making myself be accessible with people that don't even know I'm here. So that's probably been the biggest challenge for me.
Yeah, for me, I would say, I don't know if anybody else can relate to this, but I think as ADA coordinators, a lot of times we're put in the position to kind of be all things to all people. And I think, you know, we all want to be empathetic service providers, and we all want to fill every single gap that we're asked to, you know, specifically when it comes to disability. One thing that's been a challenge for me is to kind of stay away from like mission creep, and make sure that I'm not doing a million things kind of well, but really maintaining, you know, what I'm supposed to do as the city ADA coordinator effectively, and kind of help to empower those around me who are maybe better positioned to be fulfilling other roles, you know, for people with disabilities outside of, you know, city programs, activities, and services. So for me, like making referrals has been really important, and I haven't been in my job for that long. I've only been here for about 1.5 years, which means I've spent most of it during the pandemic. And so it's been super important for me to maintain strong connections to community agencies and other organizations so that I can, you know, help us all as a city to, you know, meet the disability need and not just have everything fall onto one person who then can't really effectively meet that need. I think it's important to empower, you know, the whole city network that's trying to increase accessibility for everybody.
And the one thing I wanted to say, and this is going back to Hillary and Sharonda, As Matt stated earlier on, Matt and I have been a part of the Office of Disability Rights for the last 13 years, since the inception of the office. So we can definitely relate to over-explaining ourselves and over-explaining our role and our importance. I do feel confident that in this year, especially with this pandemic and everything being new, it was a comfort to know that our Homeland Security and our mayor's office was always trying to check in with us just to make sure that, hey, if I send out this new release, what do I need to do to make sure that it's accessible to everyone? Or if we do something in print, what's the best way to get it out to people? And I think that that was one of the things that we appreciated from our current administration, knowing that they really did value the importance and checked with us on what some of the best ways to do some of the things were. And everything from making sure that some things were not only captioned through a live captioner, but also an ASL interpreter, or even for some of the public announcements that were going out, because things were changing. Some of the testing sites were changing daily and things of that nature. Just still taking that extra step just to make sure that we were completely inclusive. And I think that's something that did took us some time to get to that point to where inclusive was included on the checklist of things people had to do. But I feel good that I think that we're really a part of that machine. But it did take us some time. So Sharonda, you'll get there.
Well, actually, I'm actually going to skip on to one of the questions here, because all of you have mentioned over and over these collaborations, working with other people, not, it's important for your job to have access to other people who can do things that you can't. So it sounds to me like all of you, or I can phrase this as a question, how do you take the opportunity to partner up with other ADA coordinators, for example, in your state or county or city? Do you have relationships with other ADA coordinators? And I think that Sharonda, yeah, she's raising her hand. I think she had mentioned that she has been collaborating with the DC office. Is that correct?
Yes. Okay. So my role is ADA coordinator. I don't think people go to school to be an ADA coordinator, right? You kind of fall into it. So I've done a whole bunch of stuff, right? And I'm an advocate for disabilities. I worked in human services, but you really don't know what you don't know. And it was very important for me to get the training I needed. I work in a small agency, and every other minute they don't have any money for training. So the pandemic allowed me to get all the training I wanted, because they finally was like, I'm going to send you to that conference. And then it was canceled, and I got to do all my training for free. And I became addicted to counseling. I mean, I need counseling too, but I became addicted to getting training. And then I had been blessed that before, we had all these issues, I took training on how to do project management. And one of the most important things is benchmarking. So my co-ADA coordinator used to work for DC government, and I have always looked at the DC website because they are A++ on everything. Okay, so I have reached out to them, and then when I even talked to you, Carlene, I was like, you got to call DC. They know everything. So I'm just a work in progress, and they have really shown me. Okay, so to be honest with you, disabilities isn't on the public budget. We're in the agency's budget, but it's like we're not even shown on the budget. So I even asked Matt about budgeting. What do you pay for? How are you doing sign language interpretation? I've also spoke to talked to people in other states, because I just want to replicate what everybody else is doing, and I don't want to reinvent the wheel. And then locally, they have all of the commissions on disability, something else that one of our other duties, they have an alliance. So I have collaborated in making sure I go to the state commission meetings and working with the local partners and even attending their meetings. And it makes it so great about being virtual. You can go to everybody's stuff, but I was driving to some of these meetings because I thought it was important that I educate myself on how to be the best ADA coordinator I can be. And so, you know, a part of that is going to, when they had access meetings in DC, we've driven to DC. You know, wherever we can get some free training, we're going to take it. So that's, you know, how we collaborate.
So in DC, so we have over 80 agencies within the DC government. And so with 80 agencies, we have identified at least one person that's willing to serve as an ADA coordinator, which means that there's a high turnover in ADA coordinators within the agencies. So we spend a lot of time doing Title II trainings, Title I trainings, dealing with the employment rights of employees and so forth. But it's also helpful because ODR is also responsible for the bishop's effective communication program, which oversees the Omega Summers program that we offer. And so the fact that we have the American Summers program within our office, that allows us to form partnerships with other agencies when they need to offer American Sign Language within their agencies. So we do a very good job as an agency recognizing that our jobs would not exist unless we value the partnerships, these collaborations over time. And the fact that the city of Baltimore reached out and said, could you help us, tells me that we're doing something good. We've also received contact from the city of Portland, Oregon. And the fact that we live in DC, we actually get a lot more phone calls that should be received by the federal government. And so we field those calls based on what the person needs, and we offer and refer them back to state resources that would be helpful to them. So we're trying to understand all different aspects of a person's life that has a disability, dealing with Medicare, Medicaid, housing, employment, what have you. You need, as an ADA coordinator for the district, you need to have a very good understanding of all those different areas. So, and that takes time. And the fact that Christina and I have been in the same agency for 13 years, we do have some level of wisdom, but there's always opportunities to actually grow and help other folks too. So thank you.
Hillary, I know that, you know, you're city of Pittsburgh, but then I know that there's an ADA coordinator for Allegheny County, you know, so I wasn't sure if that's you know, if you ever collaborate with them, or, you know, who else in your state you collaborate with.
Yeah, so Caitlin Snyder is the ADA coordinator for Allegheny County, and she's amazing. She hadn't been there actually too much longer than I had been there, maybe like a year or so. And so, you know, we really had the opportunity to kind of reestablish a new way of working together and connecting the city and county. We do meet regularly. We both work with the City County Task Force on Disabilities in different capacities. I'm kind of like their staff member, and the county provides funding. And so we work really, really well together. And it's kind of been great to start a new era of ADA coordination for Pittsburgh. It's been actually like, she's been a good mentor and a great connection. And so we've been on the same page with almost everything, which has been very, very helpful.
Yeah, I can imagine. It's like you've got a buddy there to work with, and, you know, use as a sounding board too. So, So then again, in the area of collaborations, what do each of you consider, or who do you consider to be some of the most important agencies, organizations to partner with outside of other ADA coordinators?
I can go. So the great thing about being ADA coordinator is a lot of us also have our commissions. So I tried to, I'm rebuilding everything. So we had to rebuild our commission, and I found great partnership in a lot of organizations. We are fortunate that the National Federation of the Blind is in Baltimore. So I go to everything National Federation of the Blind. It's got even easier since the pandemic. So I'm in the process of trying to get that person to be a board member. But when it comes to disabilities, that's a great resource. I also work with the League for People with Disabilities. Prior to COVID, that's where we had our meetings. And they are a multi-center, and that person also serves on our commission. And I'm also fortunate to work with, just recently, I just found people. I work with NAMI, National Alliance on Mental Illness. I've also worked with a pro bono counseling. They offer a warm hotline that's 24 hours for people that have mental health, that need mental health assistance. And so I've just been fortunate that part of my job is I've been building those collaborations, and the umbrella of my positions and under the Office of Equity and Civil Rights. So there's already a, they already have strong partnerships, and I just added to it. Because one thing, I had a conversation the other day about disabilities, no matter what the person might identify themselves as. So we deal with equity issues. However, a lot of people in that population, whether it be, if I'm a Black woman, that population is going to have somebody with disability. So I try to reach everybody, and I've been fortunate to work with my other departments, because disabilities deals with the police. So we have the Civilian Review Board that's under the umbrella of Equity and Civil Rights. We also work very closely with our Community Relations Commission, which deals with discrimination issues. We also deal with our Wage Commission, which deals with employment issues and issues regarding people that have city contracts. And now we also have our equity division, which I also play a part in, because they want to make sure they're also looking at equity through a disability lens. So those are some of my partners. So that was a good question. Thank you.
Sure thing. Anybody else want to jump on that? Hillary or Christina?
Go ahead, Hillary.
Okay. The only thing I can think of, thanks, Matt, is in terms of internal relationships, one of the things that I was able to do because of the pandemic was kind of leverage the opportunity. As my colleagues here have mentioned, there's a lot more attention to the needs of people with disabilities, partly because of the pandemic. And when I very first started, I had noticed some other programs and done some digging about how other cities, handle compliance. And several cities used a model where they had liaisons in each department, New York and Seattle, and that just seemed like such an obvious, great idea. And I think when I first brought it up, it was kind of like, yeah, that would be great, but I don't know, we're not New York City, we're not as big, we don't really need that. And it was pretty obvious during the pandemic that we really did need more help. We needed more than one ADA coordinator. As you laid out in the intro to this panel session, we're only mandated to have one per, for an entity of 50 people. So, for me, I used it as an opportunity to leverage this program, and we started a disability service facilitator program in Pittsburgh, and we just finished our trainings last month. And I've got an ADA point person in each department who can kind of help extend my reach. They're already champions for disability, a lot of them. This is something they're already intrinsically motivated to do, which is extremely helpful. And so it's been really a great experiment. And I think, it's going to be a great thing to help us extend our reach, to help the public interact with the city more and let them know what their needs are. And, these people know the needs for their department and accessibility better than I do. Everything I do is a mile wide and an inch deep, as they say. So, you know, I can't go into like our innovation and performance department and say, do A, B, and C to make all of our social media and all of our, you know, communications accessible. I know basically what we need to do, but I don't know the code or anything like that. And so that goes for all of our departments, you know, the Department of Mobility and Infrastructure, who do our right of way, our DPW, you know, all of these people, they know very intimately what they do better than I do. And so it's been a great opportunity to kind of bring people together. Like I said, these are people who are already champions for disability rights. And so it just kind of is a great opportunity to start a fresh start. So we just started, but I think it's going to be amazing. And everyone seems really excited to be part of the project. So that's been a big plus for us.
And just to piggyback off of that, the District of Columbia also has ADA coordinators at each one of our agencies. And because of that, we're able to hear from each agency from their perspective of what their needs may be. And of course, as an employer, we're also helping out with our ADA coordinators when it comes down to Title I, actually dealing with employer relations. So with the COVID and with any pandemic or emergency that may happen, that's when we kind of find that how we work with our employees, how we're able to provide for our employees, kinds of shifts a little bit. So even when we're talking about how to make home more accessible, or how to make the workplace more accessible, and including our new 6-foot distancing and PPE and all of those things, that was something that really was able to come about through our partnerships with our ADA coordinators that we have at the other agencies, using them as the liaisons and their experts, subject matter experts of that agency, and kind of pairing that with our ADA knowledge. I think that was really good, a really good partnership in order to just kind of keep alliances together to make sure we were providing the best way we could.
So I also wanted to add that the agency also has 2 boards that we oversee that are connected to the community side. So we have the Mayor's Commission on Persons with Disabilities that encompasses all people with disabilities, and we also have the DC Duty Council. As many of you know, the Duty Council is actually funded by the federal government, and through the U.S. Department of Health and Human Services, and the fact that the Duty Council is within the agency, there's some level of independence from the agency where they can advocate on issues that may not necessarily be more or less in line with the overall administration. That's the job. Their job is to push the overall envelope, putting the quality of life for our citizens. And the fact that we constantly work with the population, we have a seat on the DC Age-Friendly Task Force, and that task force also has advocates from the AARP, the DC Legal Council for the elderly and stuff. So we are constantly reminded that our responsibility is to the mayor, but we also need to represent the needs of our community, and the fact that ODR is an agency with 60% or more of its employees with disabilities really gives us some credibility. As you can tell, I'm also a person with a disability. I have CP. So it helps that people are starting to recognize that people with disabilities can also be placed in the manager roles and leadership roles that could actually advance the civil rights of the ADA in the long term. So I'm greatly privileged and honored by the fact that Mayor Belzer really saw my ability to take on this agency. And so, yeah, we need more of that going on, and particularly in the role where diversity tends to be questioned. So the fact that that city of Baltimore, the city of Pittsburgh, and DC, we're all highly diversified in terms of our population, that we are constantly reminded that we need to push the envelope and still continue to reach across the aisle per se, and so we connect to people that may not necessarily understand where we're coming, but at the end of the day, it's some great work, and we're improving the quality of life for all our citizens with and without displays. Thank you.
Okay, thanks so much, everybody. I think everybody had a chance with that question, so I am going to move on to some more of the big COVID questions. One of them, of course, being if and or what is your involvement with vaccination efforts in your area? And Sharonda's got her hand raised, so.
Well, I am happy to announce that I have a seat at the table. I recently was contacted by the health department because as we moved down our different phases in Maryland, they asked me to be a lead in the vaccination effort for persons with disabilities. But I also reminded the health department, hey, y'all should have talked to me a long time ago, because every single community that you're going to, they have a disability. So we've had great conversations thus far to make sure that even that we are going out to where people are. The mayor just this week had announced a partnership with the hospital. They have a vaccination ban. The only issue that I see, this is all in the news, because the city does not have the ability to buy their own vaccinations, even though some of those vaccinations are being produced in Baltimore. All this stuff is trickled down to Baltimore, and trickled down to Baltimore from the state. So what happens is, even though we have a mega center or convention center in which they're giving vaccinations, all those vaccinations aren't coming to Baltimore. And so it's kind of like we're all trying to fight for our share. So hopefully there will be actual vaccinations for this great plan that's coming together to address those needs, and also trying to build education on about the vaccine, because I think that people with disabilities are probably one of the most vulnerable communities because they're concerned about the effects of it. So it's about, I'm going to be giving my ideas on how to do that outreach and education so we can get more people vaccinated, that it will, help. So that's my role. So I'm excited about that.
Gotcha. That's great. Anybody else? Oh, Matt, looks like you're going to step in here. Go ahead.
So in terms of DC, ODR has been doing a lot of work simply sharing the information about how the program operates, because as you guys know, there are several different tiers, phases that each state is going through, or each city is going through. Right now, DC is in phase 1B, which pretty much covers healthcare workers, people in group homes that are not able to leave, people in ICFs. I'm a person with several chronic health issues. I fall in the category of 1C, and we haven't reached the phase of 1C quite yet. And part of that is because there's such a few number of vaccines given to DC, and that's the same across the United States, that there are not enough vaccines to get everybody to get the shot. And so I'm very hopeful over the next few weeks and months that as more vaccinations and shots come into DC and other areas of the United States, we'll start seeing other groups being able to get their shots. But I spent a lot of time simply trying to explain to families and people with disabilities that we're clearly following a tier approach, and that if you're not in this current category, your time is coming, but you need to be patient because we need to make sure that our grandfathers, grandparents, grandmothers get their shots and so forth, and that our time will come, and that eventually the vaccines will come in larger masses, but you just have to be a little patient. We've been through this for the past year, and I know people are getting tired, but you still need to be a little more patient. But ODR is definitely pushing the envelope and giving appropriate advice to the DC Health Department and so forth. But I also understand that the fact that there's a shortage of a vaccine, I understand why we need to be placed in certain categories, and simply sharing that information is the most important thing that ODR can do at this point. Thank you.
Anybody else want to step in on that one, or we want to? Okay. So then my next question for everybody is, with regard to all of the different things that you've had to adapt to over this last year, do you think any of these are going to be permanent changes, and that this is going to be part of the new normal? Hillary, maybe you want to go ahead this time?
Yeah, I do think it's going to be part of the new normal. For instance, our online presence, we're planning to continue that into the future to increase accessibility, not just for people with disabilities, but also, a lot of the asymmetry information problem and participation in local government problem is really much wider in equity in terms, beyond just, obviously we have mobility issues and other types of issues, but, we also have, income issues and other types of issues of equity. It's very hard to ask, a single mom to come down for a public meeting at 5:00 p.m. or something like that. And so, the plan is to keep our online presence going. We started an Engage Pittsburgh site, which is a site that announces like all of our city projects, things that we're working on, ways that people can input their thoughts and their feedback and information so that they don't have to come downtown to a public meeting. Certainly at this time of year, with all the snow outside here in Pittsburgh, I can't imagine everybody being super enthusiastic about it. So, in a way, it kind of democratizes this dissemination of information, and I think it also helps raise a general awareness about communication needs, certainly effective communication and also reasonable modification. As many of us are lucky enough to be able to work from home, hosting these online meetings helps everybody understand, where the accessible features are, in Zoom and Teams and other things, things that they would probably rely on me for over and over again. It's helpful to kind of democratize that that mandate for all of us as city staff members. And so I think that's here to stay. I hope that's here to stay. We've spent probably 3 times as much money on interpreters as we have ever before, because one of the things I was really insistent on is making sure that for our boards and commissions and such, we want to have interpreters, we want to have closed captioning, we want to have all of those things. And so there's a level of an awareness that just wasn't there when I started my job. And so that's really helpful, just a generalized awareness of disability equity. I hope that when we are having public meetings again in person, it helps people remember not to schedule it where there are steps in front, which I would love to say has never happened, but has, right? And there aren't, ramps or something. And so it just kind of raises the general level of awareness, and also the understanding that this is really a group effort. This is on all of us. I'm here to help facilitate, but we all have to, it takes a village, right? It takes the whole city to make sure that we're really being effective in helping people, access their local government resources and participate and be included. Thanks.
So, Christina, so the fact that Hillary mentioned American Sign Language, so would you want to speak to what DC is attempting to actually do, and actually assist with saving money in terms of sign language? So would you want to speak to the cost savings that could possibly result because of the fact that we're going through COVID-19 and some budget reductions? Would you like to speak to
that? Okay, sure. So one of the things that we did find during the pandemic, of course, was that our in-person meetings, of course, would dwindle down, but our virtual meetings were heightened up. So outside of in-person, which was usually like at our press conferences, things like that, some of the other agencies would still utilize the service, but they utilize the service virtually. What we started to look into was the amount of time that was spent versus the cost of some of our appointments. So let's say we found that most of the sign language interpretation meetings, we had a minimum on our contract with the vendors. That was a 2-hour minimum. But we found that some of our virtual meetings will probably only be between 20 to 30 minutes when it came to actually meeting with some of our constituents. And we still would have to pay that 2-hour minimum. So what we decided to do was to really look into the possibility of some of the VRI acts that would allow you to pay per minute. We found that some of the things that we found that we paid for in 2020, if we had done them per minute, we would have saved about $70,000. So now we're just kind of looking at pushing that across the board. Now, of course, we'll always have in-person because we will still have longer meetings, we'll still have in-person meetings and things of that nature. But we found that the VRI will also be more inclusive. It allows people to just either walk up if they need it right away. We don't have to schedule things as far in advance anymore. So that's just one thing that we found that is more convenient for us, but it also turns out to be a possible cost savings.
I wanted to piggyback over that. I learned a lot by talking to Christina. We are in the process of seeking vendors for sign language interpretation. She taught me, about the like some of the apps you can use, and that actually brought me to telling the health department, everybody that you have, you should have an app, because you could have somebody there that comes up to the place that didn't tell you in advance. They might need a sign language interpreter. Unless you have someone on staff, that's something you need to have. So I want that to be the new normal. I want the new normal is you shouldn't have to show up to everything, okay? I don't know if you've been to downtown Baltimore City. I look at Baltimore City and Pittsburgh a lot alike. It's not accessible like it should be. Pittsburgh has a lot of hills. We're old cities, okay? And I just find that we need to be more accessible. If you have a meeting, why do I have to come to City Hall? I've been adamant that we had, I was building the board, the Disabilities Commission. And so I challenged the law department. There's some obscure law that says you got to meet in person to sign a book. And I said, well, I need a reasonable accommodation because we got a whole COVID-19, and I don't want my people with disabilities coming to City Hall unnecessarily and risking exposure. In addition, we have construction at the accessible entrance, and I don't know how safe it is, So they made, for the first time ever, they had online swearing in of commissioners. And guess what? Because of me, that kind of became the standard at the end of the administration, because our previous mayor had a quarantine, but if I didn't, I'm kind of line stepper a little bit. And so I'm always going to ask that question and make you prove to me that I'm wrong, because we need to start sticking up for people and not be afraid of changing the status quo. So my whole thing is, let's make everything more accessible. Let's make everything government. It shouldn't just be who you know and if you can come to the meeting. It should be accessible to everyone. So I think that's going to be the new change. Thank you.
Yeah, that's great, Sharonda. Thanks so much. And this is really, really great information. I wanted to go ahead and move on to some of the questions from the audience, though, because we've been getting, we've got some good ones here. And one of the first one being just off of what you were saying, Sharonda, what have you learned about, you know, has COVID changed the process of putting a reasonable modification in place? What have you, what have you learned, or has it impacted that at all?
Well, let me just say this. I think it has impacted it because now people became more aware. I don't think everyone's aware. During the pandemic, I was able to reestablish who our ADA coordinators were, because like I told you, we went through a whole bunch of different mayors, so that sometimes can change. And we've had training, so they can start identifying some things that they may not have done before. And I'm trying to make it more like, hey, tell me, let's develop a better process in ADA coordination. I do also want to say there has been possible changes long term, because a lot of people have complained about sign language interpretation. So it's now the standard. So going forward, there's a whole lot of things that people have always said, well, that's just the way we've done it. Well, I'm trying to change that conversation, that we got to look at everything differently. So I hope that answers the question.
No, that's great. Yeah, it absolutely. Anybody else have anything you wanted to add to that? Okay, well, then we can move on to one of the other questions, which is, can you speak to how or whether you've been working with emergency operations or emergency managers during the COVID response?
Since I'm up, I can answer that. Actually, I've been having meetings with them on a consistent basis. They, back in the day when I had the long-term ADA coordinator, the ADA coordinator was in everything. And so they have brought me on board, and actually I have a meeting with them tomorrow because we're discussing getting some more accessible information on their website. So I have been brought into that. Even they brought me into being we just had, I haven't been involved with anything like when there is kind of emergency hurricane, snow, things like that. So I'm kind of like on call in those emergencies to make sure they're addressing accessible issues. So I have been involved with them. It's kind of been like as an advisory sort of person. So it's good that we started to have the conversation so we can talk better. And they've actually had me even educate some of their human resources people about Title I. So I've played a role with the emergency management, and we've also worked in coordination with them with giving trainings to our commissioners and talk about some of the, and giving feedback from our disabilities commission to our Office of Emergency Management.
Gotcha. That's great. Matt, looks like you've got some to add to that. Great. Go ahead.
So DC Homeland Security and audio are tight. That's actually by design because DC, we're currently going through a legal settlement, and some of you may be familiar that in terms of emergency preparedness, in terms of 9/11 and all the hurricanes, all of the major cities along the East Coast were sued more or less on their emergency preparedness, and back in 2019 the district settled, but basically what we needed to do was have my agency work very closely with DC Homeland Security on all of the emergencies that we may deal with. So So, for example, the fact that we had to go through COVID-19 and the pandemic, we were very involved. We're working with DC Homeland Security about offering the actual suggestions and recommendations on how to push the info out. The fact that we had a presidential election, we were working very closely with the DC Board of Elections and Homeland Security on that, and most recently dealing with the January 6th event that occurred on Capitol Hill. We spent a lot of time working with DC Homeland Security, offering how do we make the information accessible. The fact that when our mayor did press conferences, we definitely needed an interpreter there, and whenever there's an emergency, the good thing about emergencies is that DC Homeland Security has a lot of federal grants from FEMA that could assist with the costs and stuff like that. And so, but making sure that the information was accessible, and that has been a very, very consistent theme throughout this event, that the information needs to be fully accessible and stuff like that. And so there's been a lot of great lessons learned in doing the partnership with DC Homeland Security and ODR over time. And there's a general respect between the two agencies, and that's how it should be. But I realize that doesn't necessarily exist in other states, but it's definitely possible. Thank you.
Thanks, Matt. Anybody else want to add anything to that? Okay, great. So we can move on to one of the next questions, which is been a touchy one. Have you received questions around accommodating people who cannot wear masks? And is this something that you've had to talk through, I guess, other people in your agency, organization, with how to manage this? And what are your suggestions?
This is Sharonda. Yes, I've had the conversation, but I do believe there was some advice given that regarding masks, and I just refer back to that. There hasn't been a particular, a lot of us don't have to work in the buildings, but there are there are people who are essential employees, and they are still required to wear masks. I haven't seen where the ADA has said everything's a case-by-case basis as all accommodations. So I haven't been asked anything. I have basically given what the EEO said as far as employment issues. But I personally have experienced where I've seen people say, I can't wear a mask, and I don't know if that is that's something that has to be addressed on a case-by-case basis. But unfortunately, in this pandemic, it's not like one of those things where you can just say you can't wear a mask and they just let you. That's my understanding. So, but I always refer back to what has the advice that was put on the EEOC's website that doesn't necessarily say that. But one thing that has come up is like when you're in close quarters, and we've had to deal with that. So right now, like our homeless community, they've actually put them in hotels because people might say, I can't wear a mask. What do you do with that? Is that an accommodation? So we're at this point, my fellow ADA coordinator is working with homeless services and changing how the shelters look. But they have not been in shelters because those questions could come up because you're living in close quarters. So that's my answer. I'm sticking to it.
Right. Excuse me, Hillary, how How's that been for you?
I would say, it's been difficult. I have received a lot of emails asking for clarification around those rules, maybe hoping for some kind of, easy standard, but just as Sharonda mentioned, it really is a case-by-case basis. A lot of times people will reach out to me. I don't know if, I assume this probably happens to other ADA coordinators, where they're asking me about Title III entities and businesses and looking for advice. And I, always make it clear that, I'm a Title II coordinator, but this is what I know. And I let them know that they can ask for a reasonable accommodation, but simply saying that you have a disability does not preclude you from, the obligation to wear a mask to keep other people safe. Because again, we get into weighing equities against other equities. There are people, who have respiratory disabilities and other disabilities, that we all know this. I'm not telling anybody here this that doesn't know that, but that affect their health. And so if you don't wear a mask, you're putting them at a greater risk when they're in a store, in a restaurant, in a building. And so a lot of times that just ends the conversation. I think maybe sometimes they're just looking for somebody to say, well, the ADA coordinator said. But I do help people for those who really they can't wear a mask, either for health reasons or anxiety reasons or something, and just let them know it's your right. You can ask for an accommodation, but it's not carte blanche to just pretend the pandemic isn't happening. Go to restaurants, go to what have you. And so it's been a challenge, but I think one that we've all kind of been able to manage better than I would have expected. It seems like it comes up less and less often now. So I'm hoping that information is becoming more clear.
Great. Yeah, let's hope so. Just really quickly, we had somebody who asked if, excuse me, I think it was Sharonda, if you could please, I think it was Matt, sorry. Repeat the process for paying sign language interpreters by the minute rather than the 2-hour minimum. I think Christina had that. So,
yeah. So Christina can step in. So we're actually taking the best practice that's coming from the Metropolitan Police Department. All of the police officers have access to the video remote interpretation on their phones. And the fact that we have a huge drug population in our backyard because of the university, that's very critical. And so what the Metropolitan Police Department has done is that they have their BOI contract, which gives them a lower rate. And so instead of offering in-person interpretation, they often go with the BOI systems. And so we're learning from other agencies that have already done this. And so Christina can offer more details. Thank you.
Yeah, so we found that our police department actually has all of the officers equipped with an app on their phones that allows them to have an interpreter on the spot. In addition to our police department, also the Department of Behavioral Health. So we actually have some of our social workers, their laptops also have this same app, which allows them to do home visits or in-person meetings and just dial up an interpreter right there on the spot. And because of the success that it's had with these individual agencies, we are pushing to do this as a citywide initiative. Now, once we change it to a citywide initiative, we'll be able to have it at front desk everywhere so that persons are able to just dial up and do it right away. One thing we also wanted to take into consideration is our public schools. Parent-teacher meetings, those last about 15 to 20 minutes, especially when they're doing the one-on-one conversations. That's another time where we want it to be available to our teachers to speak with parents right away on the spot about whatever the concerns may be with those students. again, we're trying to go away from the 2-hour minimum because, of course, that cost can be between $150 to $250 in some cases, and not even considering if you have some jobs that are rush jobs, which means that they were scheduled with under 3-day notice. So because of that, we think that having this service, per minute dial-up services, and there are a couple of different companies that use it. We are actually in the midst of advertising the citywide contract because we want to hear from as many of the different companies. We've spoken with 3 different companies that do it, but we just want to make sure that we're covering the gambit of all the different companies that do have the VRI service available. Instant, you pay per minute, you only pay per use. It's just a really good benefit that also provides more inclusiveness throughout the agencies.
Great. Thanks so much for repeating that information.
No problem.
I think we've got about 5 minutes, so I am going to pose one last question to all of you, and that is, excuse me, so what are your final recommendations or thoughts or tips for other ADA coordinators with regard to managing issues around the pandemic? So what kind of pep talk can you give here? And let's see, anyone who wants to jump in, Hillary, it looks like you might be, or Christina. Christina, you've been quiet, so how about you pitch in for us?
I would love for you to repeat that to my office. They never think I'm quiet. But definitely, for sure, I think the one thing to always focus on, especially now that we've kind of, it's almost been a year now. If we think 1 month from now, it will be a year that we've been dealing with this. So we also have to make sure we keep the idea of accessibility, full accessibility on the forefront. So if we're thinking about any new programs that we want to roll out, even these trainings right now, we've kind of figured out the new realm of full accessibility from anywhere, from home, from the office, from in our cars now. So I think that's one of the things. Just remember, as long as we can keep accessibility on the forefront, I think we can still manage to do everything that we were doing pre-pandemic.
Great, thank you. All right, who we got next?
I can go.
Okay, thanks.
I think a lot of us can learn from each other because I always find that the great thing about being an ADA coordinator is there are avenues where I can reach out to other ADA coordinators. Literally, as I was talking, somebody inboxed me on my LinkedIn like, Sharonda, hey, I didn't know you were an ADA coordinator. Those are things that you can, like I reached out to, I just do cold calling, say, hey, I'm from Baltimore. What are y'all doing? So it's sometimes good to get good information. And I do say I just love the District of Columbia. And out of all these cities, and I've been to all of them, we do have the best football team. But it's okay to go ahead and, lean on other people.
Hillary, I'd love to hear from you. Go ahead.
Yeah, I mean, I think there's so much I could say about this. And by the way, you will all be getting LinkedIn requests from me. So yes, I think one thing that has kind of sucked, for lack of a better word, is that, we don't have as many opportunities to meet each other in person. I was so happy that I was able to go to the Mid-Atlantic update in November before the pandemic, because it really gave me a lift and helped me understand what I was supposed to be doing for the city. And so, for me, I would say 3 things. Just being super firm. It doesn't seem like anybody on this call has a problem with that. It doesn't seem like most of the ADA coordinators I meet do that, but it can be kind of a lonely job, right? I think very few of us are in a position where we have a whole team of people that we can rely on. And so I think it's super important to stay firm when something needs to be done. I've been trying to talk, I've had senior leadership try to talk me out of certain things that I knew, weren't correct. And so, they may not always do what I want them to do, but I have been called a badass by a couple of them in meetings. And so I think being firm and just being confident that, you're probably the expert in a room when something on the issue of accessibility comes up. And so just be confident about that. I think being super responsive is helpful. I have a lot of times, I call people back and just say, I'm so sorry that, that's either out of my depth or not, within the city's obligation, but, I will always respond and help make a warm referral if I can. But, it's important to manage expectations, but still respond to people. I think people have, that expectation of government that maybe we're not as responsive as we should be, rightly or wrongly. And then the last thing is just empathy. I always tell people, I lead with empathy. I think, I get yelled at a lot. I'm sure most of us do. And I think even if people are hoping or expecting you to resolve a crisis that they're in and you can't do it, it's understandable that they would be reaching out to a government authority for help. And so, you can be a source of comfort and you can make a warm referral, even if we are limited in our reach. Thanks.
Thanks, Hillary. That is really good advice. And I just want to say, I love all of you ADA coordinators. You guys do really important work. And so I appreciate you. So I want to thank Christina, Matt, Hillary, and Sharonda again for being with us today. I think that wraps it up. And so if we could move on to the next slide. For those of you who have already paid for a certificate of participation, the continuing education code is coordinate. Again, the continuing education code for today is coordinate. You'll want to check the reminder email you received about this session for instructions on obtaining a certificate of participation or credits for this webinar. If you could please email the code above to adatraining@transcend.org by 5 p.m. Eastern Time on February 16th, 2021. Slide 11, please. And I want to thank you again for joining us and let you know that our next webinar, which actually will be on February 16th at the same time, is going to be on the return to work in the midst of COVID. So for those of you that had employment-related questions, hold on to those. Join us again next month. Bring them with you. And the Job Accommodation Network will be there to answer your employment questions. So again, thank you for joining us, and I hope all of you have a great day. Bye-bye.